Welcome everybody to Healthy Seminars. My name is Lauren Brown, and I'm your host today. And I want to have that big thank you to our moderators and the tech support that makes this happen behind the scenes. Lorianne Sloan-White and Sandra Grassa, big thank you. And then to Mike Berkley, who's put together a lecture for us on endometriosis, which we're going to get to very shortly. Big appreciation as well. So I'm going to share my screen here and just show you things that are happening and just what you should be aware of. Reminding you that on the Healthy Seminars website, we're constantly putting these community, unity, immunity lectures. So if you go to resources, as I've done here, and you scroll down, this is the Community, Unity, Immunity lecture series, as well as part of the IFS, Integrated Fertility Symposium pop-up lecture. So this has kind of like two things happening at the same time. In our Community, Unity, Immunity lectures, we offer these as free live webinars, and then the recordings get archived and they're available with your subscription to the community library. And so that's where you can find the recordings for any of our past free live webinars. We have 10 years of content and growing, like we've gone back for 10 years worth. And there's over 190 lectures in there that you can watch. So enjoy that. We have the Integrated Fertility Symposium happening. It's something different that we're doing for 2021 online. It is over 2 months. We have up to 36 hours of CEU approved content, so CEU and PDAs. And then we have pop-up lectures. So today is a pop-up lecture with Mike, and it's not approved for CEUs, for the love of learning. And this recording and its handouts will be part of your IFS. So it will be under the pop-up lecture section that I'll show you in a minute. If you're watching this today, April 30th, 2021, I will remind you that the early bird ends today and you can still register for the IFS to partake in up to 36 hours of CEU content, and then even more content like this pop-up lecture from Mike that's not CEU. So there's lots of lecture over 2 months and time for interactivity. I'll show you what that looks like in a moment. Keep visiting our resource page because this is the calendar event. So we always put up what's happening in the calendar event. So today we got Mike Berkley talking about understanding endometriosis from a east-west approach. And then if you scroll down, you can see other things that are happening. So we have another Community Unity lecture free for a live webinar from David Euler, palpation-based lecture in acupuncture. And Yvonne Farrell's mentorship program's open in the IFS, and then there's Berkeley. So this is the page you go to find out what's happening. Now, if you've registered for the IFS or you want to register for the IFS, just click either, I'm not logged in, you can click on my account, and then on the left-hand side, there'll be a menu for IFS, but make sure you're logged into the Healthy account when you do this, ideally. Go to the IFS website, and here is the IFS website. So I'm here, and I'm logged in. I'm going to go to the dashboard, and this is where you'll find all your CEU lectures. So just to let you know, this is what's going to be available to you guys. And a few things I want you to be very aware of on the IFS website. There's a form section and there's a chat section. So here on the dashboard, if you look around here, for those that are part of the IFS, on the left-hand side, you can see things are happening. If there's a live event, like we have this weekend, that will show up here by clicking on this link. Okay, so you can get the Zoom link. So I should mention that right now. We have May 1st and May 2nd, the first two CEU-approved live events happening. Lorena White's talking about how to integrate with an IVF clinic. She's an expert to talk about this because Lorena White is an MD, OBGYN, IVF specialist, and she's TCM trained. She did the TCM training, not the weekend, the full program. And so she uses herbs and acupuncture in an IVF setting, and she's going to let you know if you want to integrate with an IVF clinic, here's how to approach and integrate them. That's on May 1st. And then May 2nd, Magarelli's giving a talk on the fertile soil and looking at the science behind what naturopathic medicine, so the nutraceuticals, diet, lifestyle, what acupuncture and herbs are doing on a cellular level to optimize egg and sperm quality. It's quite a brilliant lecture. So that's May 1st and 2nd, and we have an interactive Q&A with both speakers, and you use the live events to check that out. You can also find our sponsored lectures and like Mike's lecture under pop-up lectures. basically, when you're registered for the IFS and you know that, and you see your name here, you'll see the forms and you'll see this dashboard. The dashboard is a great place to jump off to find things. But really where the activity is, the interaction, which is what we really wanted to create over this 2-month period, is you go to the forums. So if you click on lectures and case studies, you can start to discuss things about endometriosis, for example, PCOS, egg quality. And then we have live events. This is an important page to go to if you are registered with the IFS, because this is where you get your links if you want to interact with the speakers. All the talks are going to be available on demand, but sometimes you want to interact. So our panels, our live panels with our speakers and guests, our Q&A with the speakers, and our live replays and Q&A with speakers, come to the live events page in the forums and you'll find them. So for example, May 1st, if you click on this link, there'll be in there, it'll tell you what the topic is, and it'll give you the link to get the Zoom. So if you're part of the IFS and you haven't gotten the Zoom link yet for tomorrow, May 1st or May 2nd, go to the forums and go to the live events section. This is for people that are registered for the IFS. And so again, go to the live events. Any special offers is under the special offer link for the IFS registrants. For example, 2 live webinars we have in May, one with Leslie Aldershaw for 16 live CEUs and one with David Euler for 4 live CEUs. They're not part of the IFS, they were already planned, but there are 2 live events happening in May. IFS registrants can register for those live events for 50% off. Go get the coupon in that coupon form. Here's our conference calendar. So this tells you kind of what's happening. So we have a live event on May 1st and 2nd. Then we're releasing a lot of these on-demand courses. Make sure you watch Susan Johnson's Master Dong for Fertility course, because on Friday, May 7th, we have a live Q&A with her. And then on May 8th, we have a live Q&A with Paul Turek and Olivia Poirier on male fertility. And we have a guest doctor on there as well that's done tons of research. So this is where you find all the live events. And we're going to keep adding panels and Q&As and pop-up lectures to that. So you want to pay attention to the conference calendar. And then lastly, or not lastly, but to keep the interaction going, we created a chat function. So when you click on the chat function here, you can see who is currently, I just got to move something out of the way. You can see who's currently on the IFS website. So right now, 31 people are logged into the site watching courses and moving around. So that's what that is about. And you can now chat with your colleagues. You can say hi, hello. You can do a video chat. You can share documents. We didn't want you to just be online and watching courses all alone. We've been doing that for over a year now because of COVID. So what we wanted to do different is we wanted to create an experience with the forums. You have this ability to chat and discuss the lecture material. You can debate the lecture material, bring up case studies in the forums. And then in the chat, you can start to see who's online and start to hang out with your buddies and say hi to them while you're studying and learning. So really wanted to create that interaction again. All right, I'm having problems with my buttons here. I don't know how to get out of that. Okay, stop my share. Oh, I can do it. No, I can't. I somehow picked a pointer. I'm gonna stop my share. Good. All right, let me try that again. I want to just finish here before we go to Mike. So that chat function shows up when you are logged into the site as a registered IFS user. And so it's that little black circle with 2 chat boxes in there. This is where you go to connect with each other, this chat function, and you can have that interaction with your colleagues. So we really wanted to create interactivity. And the one last thing I want to let you know that's really unique to IFS, we got 2 months of it. We got lots of interactivity built into it. And then we have public educational videos. And these public educational videos, we asked a lot of our speakers to create content for the public that would inspire them to seek you out for integrative care. So not only are you getting their professional talks for CEUs, but they created these 15 to 20-minute lectures for the public that are available for our IFS people to share. So you can watch a talk from Magarelli, and now you're going to get really excited because, oh my God, our stuff really works. Look what they show, the research. But you may not be able to articulate it like Dr. Paul Magarelli. And now you can share this on your website, on your Facebook, on your Instagram. And so patients watch this, and at the end of the video, it says, check out the practitioner that shared this if you want integrative care. So you get to share this. And if hundreds of us are sharing this on the same day or week on our social media, that's a powerful way to inspire the public to seek us out for integrative care. So we have about 15 of these. We've released 1, 2, 3, 4 of them so far. So we got a lot more that we plan to release. And that's one of the things that we're really excited for. All right, somebody sent me a chat. Everybody tell me to stop talking. Let's see. See, Sandra sent me a little chat there. So you see how this works? He's sending a little chat to me in the chat box. So this is how you get to interact with each other on the IFS website. And I can block him if I want or make myself look online, which you probably all do to me. All right, we're ready for our lecture. I want to remind you, our speaker today is Mike Berkley. Stick around for the Q&A at the end of this 45-minute lecture. We also have a special announcement from the American Board of Oriental Reproductive Medicine. Mike Berkley is a fellow of the ABORM, as am I. And there's a special announcement and presentation that they're doing right at the end of this lecture before we do the Q&A. I do want to remind you that this is for educational purposes only. This is not meant to or intended to be medical advice. If you have a health condition, please do seek out a healthcare provider because this is only for educational purposes only. Team, can you please bring up the video? And as they're getting this ready, for those that are registered for the IFS or anybody that plans to, you still can register for this IFS. It's going to span over 2 months. 2 things that are very important. If you want to attend any of the live Q&As, we have one this Saturday and Sunday, please go into your IFS site, please log in and go to the live event form, and that's where you'll find a link to get the Zoom sign up for Saturday and a different Zoom for Sunday. So please do that today if you want to join in for the Q&A with the 2 speakers on Saturday and on Sunday. And the other thing is, please start to look at that chat feature and look at the forums every day because we're going to be posting things that are relevant and important to you. All right, team, let's play this video. Hello and welcome to the Integrated Fertility Symposium. My name is Lauren Brown. I'm the chair of the IFS. And today is a pop-up lecture, and our speaker is Mike Berkley. Mike is well known to be one of the first, if not the first, Chinese medicine practitioners and clinics to specialize in reproductive health from an integrative and especially Chinese and acupuncture approach. I had the privilege to attend Mike Berkley's lectures in the early 2000s and have developed a collegial and friendship with Mike. We're both fellows of the ABORM. And I've always enjoyed listening to Mike's talks, especially around endometriosis, which is why I asked him if he could give a presentation for this year's IFS in our pop-up lecture section on his approach to endometriosis and his understanding both the Western and Chinese medicine and integrative approach. I do want to remind you during this IFS, these pop-up lectures are for the love of learning. There are no CEUs attached to this lecture, so you don't have an assessment tool or evaluation. You just get to enjoy and listen to Dr. Mike Berkley. Mike, take it away.
Hi, this is Mike Berkley. I'm thrilled to be here to make this presentation or present this presentation on endometriosis from an East meets West approach. And I thank you all for attending. So without further ado, let's move forward. 2 to 10% of childbearing women in the United States between the ages of 25 and 40 actually have endometriosis. Symptoms can begin as early as puberty. There is no cure for endometriosis from a Western medicine perspective or from Chinese medicine intervention. Endometriosis is a disease in which endometrial tissue has implanted in areas outside of the uterus. It can go into the bowel, the ovaries, the ureters, the lungs, the diaphragm, the nose. It's a rather tricky and interesting disease. Nobody has full knowledge of this disorder. There's still a lot of research going on. Endometrial tissue responds to hormonal stimuli in the same way as does the endometrium, except the endometrium is shed at menses and endometrial implants are not. They remain, they adhese, and they can cause severe pelvic pain at ovulation and menses. Of course, one of the interesting things about endometriosis is that a patient can have stage 4 endometriosis, which is a very severe presentation of endometriosis, and not have any pain whatsoever. And conversely, a patient can have stage 1 endometriosis, very minor presentation, and have severe debilitating pain at ovulation and or during menstruation. So pain in and of itself does not reflect the level of disease. There can be extremely painful periods, heavy bleeding, obviously infertility, pain with intercourse, painful bowel movements, and severe low back pain during menses. The painful bowel movements will occur usually when the patient is menstruating. Why is there pain? Why are there painful bowel movements? Why is there rectal pain? Because endometriosis is not uncommonly found in the cul-de-sac, which is the area between the rectum and the uterus. Some ways to diagnose endometriosis are via pelvic MRI, a transvaginal ultrasound, or laparoscopy, or BCL6. A couple of interesting things about this slide. It seems that fewer and fewer laparoscopies are being done, diagnostic laparoscopies. And what that means is that there are more patients that have endometriosis that are not being diagnosed. So if you look at SART, you will see that the amount of patients that present with endometriosis is actually declining, but that's in fact not the case. That is not true. What is true is that there are many fewer laparoscopic diagnostic procedures being done, and so it appears that there's a reduced presentation or reduced manifestation of endometriosis. That is absolutely not the case. In any event, laparoscopy has been, up until this point, the gold standard of diagnosis and treatment, and it is still a necessary intervention for treatment. BCL6 is the new and improved method of diagnosing endometriosis, and we'll talk about that more later. So there are some medical treatments for endometriosis as opposed to surgical treatments. One of these treatments is being on a GnRH agonist for 3 months, which does what? It shuts down it shuts down estrogen. It prevents the emission of estrogen from follicles, and of course, the food, if you will, that supplies endometrial implants is estrogen. So if a patient takes Lupron for 3 months, it can actually, to some extent, make the endometriosis quiescent, and thereby perhaps improve and increase the chances of conception. In the absence of tubal obliteration, conception may occur with intercourse. And of course, with tubal obliteration, IVF would be the go-to modality of intervention. So Lupron does not cure endometriosis. As I stated earlier, there is no cure to endometriosis. Laparoscopy is a more semi-permanent approach. The word semi is the operative word because there is no permanent approach. There is no cure to endometriosis. Now we're going to talk about a fairly new diagnostic protocol for endometriosis. You can look up Dr. Bruce L.Ac. I believe it's L-E-S-S-E-Y or L-E-S-S-Y. Look up Bruce L.Ac, MD. I believe he's in South Carolina. He is one of the main proponents of this test, and he's done a lot of research on it, and you can find lots of information through Dr. L.Ac. So BCL6 is a fantastic new thing because it allows patients to get diagnosed with a 95% confidence interval, if you will, of having endometriosis without having to do a laparoscopy. So BCL6 is a protein marker of inflammation that is associated with endometriosis when found in endometrial tissue. It has been shown to be overexpressed in women with endometriosis. This inflammatory response causes a disruption in the uterine lining, and it's enough to block implantation or dislodge an embryo, leading to miscarriage. Another thing I want to say about BCL6 is that BCL6 it has anti-progestogenic effect. And so what that means is that a patient with endometriosis will not have appropriate and adequate progesterone receptors in the endometrial lining. And of course, progesterone is necessary and mandatory to facilitate a clinical pregnancy and a live birth rate. So one of the mechanisms of action of infertility in the endometriosis patient, amongst many, is that it prevents progesterone from acting on the endometrium. So here's